And welcome back, and we're moving into our first segment for the morning. Like you rightly mentioned earlier this morning, Marlene, somebody else is actually celebrating something, and we're talking here the KHMH. Yes, Carl Hushin Memorial Hospital celebrating their 23rd anniversary this year. And we've got the folks in to talk all about it. As a matter of fact, we've got the CEO of the KHMH, Michelle Hoare, who is in with us. And they already mentioned that we brought her on the show. And of course, Tylon Tillett, who is the Public Relations Officer at the KHMH. Guys, good morning. It's so nice to have you in.
Good morning.
And welcome.
Thank you.
Thank you.
23 years. My goodness, all the way back in 1995? 95, was it?
95.
In terms of the building and the structure there at the KHMH?
Yes.
So, how is that like? Let's get back to it. Let's get back to 1995. Bring us up to speed in terms of the services then and the services now.
Oh boy. And I was right there, 1995.
Wow.
Actually, I was part of the commissioning team to prepare the hospital for the move. So it is indeed a pleasure to see where we've moved from 1995 to 2018. Services. We provided the four basic specialty services at the time: medical services, pediatric services, surgical, general surgical, some orthopedic, and obstetric and gynecology. Of course, our accident and emergency service was always there, and we had outpatient specialty clinics. So that was basically where we started, with 109 beds, really, 351 or 2 staff, thereabout, at the time we started.
Wow, that's a lot.
Today we are upwards of, I understand yesterday the last count was 652 staff. So I always tell people that the definition of a village in Belize is 300 persons. So the KHMH is essentially 2 villages, one that operates during the day and one that operates during the night, to bring you 24 hours access to the highest level of healthcare in the country.
So you're saying at one time, like for instance, right now during the morning shift, how many staff is there?
At KHMH, I would say about maybe 300,
Yeah.
covering the entire hospital. It's not only clinical services. Remember,
Yeah.
we have all the support services that, cater to the major clinical services that we have. So,
Yeah.
And it's important to mention that a lot of people equate healthcare with the doctors and the nurse. But there are a lot of persons behind the scenes, dietary aid, the person from housekeeping, and all of these persons play an important role, because it doesn't matter what the doctor's diagnosis is. If the facility is not clean, there will be an infection outbreak,
Of course.
and so on. So the person that you go there and you see mopping the floor is just as important as a doctor that is nicely dressed and giving the injections. So
Yeah.
we congratulate our 630 strong, well 652 strong, that brings healthcare to the Belizean nation.
Yeah. No, it's interesting to hear, CEO, that you were there when the move took place, when you moved over to this building 23 years ago.
I was there high
And
school.
now you commemorate this anniversary as the CEO. You have been recently placed in this position, and it's a great time to really talk about what your own vision is, taking over the leadership of the institution.
oh boy.
It's a challenge.
It is a challenge. It is a challenge, one that I embrace.
Yeah.
It has been a challenge for all the years that I've been with KHMH, and even when we were at the old Belize City Hospital. But the vision for KHMH, looking at my role as a CEO, basically is for us to really be the lead in providing quality healthcare services. That is something that we believe we can achieve. We are on our way there. Actually, we are the only tertiary hospital in the country providing full services, because you do have smaller hospitals that do some tertiary services, but we provide the full gamut of services, and it's all interconnected.
Yeah.
So really, this is a vision for me. I really would like to start looking at accreditation for some of the services, because that is the pivotal, once you've reached accreditation, you've arrived, really, in terms of healthcare services. And it doesn't matter if we don't accredit the entire hospital, because that's really a very long-term goal. But in terms of services, we have imaging services that we could look at. We have our laboratory services that we could look at, other critical care services. So that is where we would like to go. And once we've done the first service area, we'll be on our way, and gradually the hospital. It's not unachievable. It will take a lot of work, some finances, support nationally, but it's achievable.
You know, taking over the leadership at this time where the hospital is always under scrutiny, I think, to be fair. As we were speaking during the break, oftentimes we only hear the negative stories and we don't hear the success stories as well. But at the time when you took over the leadership, the concern was the infrastructure, the closing down of services, and the challenges there. From your perspective, how do you see yourself helping to change the image? Because the financial constraints are one that that's one of the challenges that you'll continuously face. But it ties very much into the public perception. So how do you see yourself trying to work towards enhancing the image while still battling the everyday dollars and cents?
Okay, basically it has to do with your workforce. I mean, the human resource capacity that we have. They're there, they've been, you know, behind the scenes, pushing, committed to the cause of providing care. So it's about embracing what they bring to the table, right? Promoting, recognizing their efforts. I mean, I believe once they understand their role, they understand how much they are appreciated, that will take care of the image part of it, because they'll be satisfied. I mean, a lot of us are there not because of the money, as you all know it, right? We are there because we want to be servants of the people. And that's exactly what healthcare is all about, right? Providing a service to the people. So once our people, our staff understands, they are recognized for what they do, the image part is going to be taken care of, because they will provide the best of themselves for the people, and that will come across in a positive way to the image. Of course, let the administration deal with the issues of supplies and equipment and, you know, making sure they get their salaries on time. That's our headache. And we will, we'll work that through, and we'll make sure that happens for them. Keep our staff happy, right? Everybody, as Tylon said, every single staff member in that institution is valuable. And without their service that they provide, what will Calhoushna be? Right? So every single person.
And if you guys have noticed, we are no longer silent about what we do. We're 630 strong, and we've encouraged the resolution of the staff to be strong. There are things that are going to be said in the public, but we know that if we give out 100 injections, oftentimes 99 of those injections are successful. One happens to swell up somebody's hand. That's what reaches social media. So instead of looking at social media as an enemy, the KHMH has embraced social media. We are pushing and being loud about and tooting our own horn and letting the public know this is what we do. We take care of you. You understand me? Yes, it's not a perfect place. It's a place where life and death meets, and it's a place where all the outcomes are not going to be good all the time. You understand me? Some people will survive. Some people are at the end stage of their life, but we try to be there and project that onto the people receiving our service. And so we've been very loud about saying this is what we do. You understand me? This is what we can do. We will take care of you.
You know, and I alter the words of kudos to the KHMH, especially for the 23 years of serving. I've been there a few times myself. You know, but the service has always been up to par, and that's one of the things that people don't shed light on. And you're right. Well, out of the 99 injections that have been given, one person might swell up. It's just the way of life. Now, one of the things that people continue to make mention of about the KHMH is the enrollment of the Filipinos or you know, the folks from Africa as well. You know, but they're healthcare providers. Can we touch on that, especially for the fact that after 23 years, we're seeing much more people coming in, and you guys are trying your best to roll proper healthcare. What is this like for the KHMH?
It's a beautiful experience, bringing culture together. They come with the one set of training. I mean, nursing care is nursing care. The training is the training. It's standard across the board. Belize is second to none. So when they come, it's just the culture, you know, that they would have to adapt to. We have to adapt to their culture, they're adapting to our culture. Why do we need to bring them in? The issue is we just don't produce enough healthcare providers in our country. We only have one university in this country, and the programs that they have are very limited. And so as the healthcare industry expands, of course, you would have to look for more specialized professionals. And if it's not available in country, then you just look out.
Yeah.
We've just signed on to the CSME. I mean, they come from the Caribbean as well,
well.
right? So they come from different parts of the world. We have quite a mix. But the institution needs to set their goals, their standards, their policy, and they conform to that.
Yeah.
Right? So it's not that
Looking-
everybody come with their own agenda, you know. That's not a thing.
Looking at this picture, I would like to highlight the 27-year relationship that focuses on our doctors being trained in Cuba. We see some of the doctors that just returned from Cuba that started at the KHMH on Monday, and that's been pivotal. And if I remember correctly, I believe since the program started, over 200 doctors have been trained in Cuba from Belize, and that's a partnership that we celebrate. And the international flavor that comes to the KHMH exposes us. It brings different cultures. Whenever we have Nurses Week, we always celebrate. We have cookout with different food, and we enjoy each other.
Really?
Yeah,
Yes.
we blend up like that.
You know, and I think what John mentioned, that the larger picture is obviously looking at what is a global problem, and that's the nursing shortage. And you actually, prior to your role as CEO, you were heading up the nursing department. Talk to us about where you see us being able to mitigate the problem of the shortage of nurses. I know we have people coming from other countries, but even so, they're extended schedules and not having as many people graduate from the university and working with the institution. Many have goals of moving beyond the country as soon as they graduate.
It's a global issue. It's a global issue, and I think just recently I was at a meeting with International Nursing Council and basically sharing with nurses across the world. They've been having the very same problems, and you have people coming, professionals coming from different parts of the world. They just look for jobs. Sometimes they look for it because they like a certain part of the world more than they like their own country. So that is one area. But to mitigate, it basically means that we would definitely need to partner with the academia, University of Belize, Ministry of Health, to look at those specific areas where programs need to be introduced. We've been doing that to a certain extent, and it again depends on their finances, their ability to be able to respond to the needs of the country, because it costs. If you're going to start a program in a certain specialist area, it means that you would have to have persons trained in that particular field, you know, a faculty prepared to deliver. So it's a very costly venture. Mitigating will be definitely a very long-term issue because of the position where our country is at this point. But I believe blending, mixing is not a bad thing. It's not a bad thing.
I like the way you summed that up, of course.
So we talk about the staff side of things, and I think you're so right. You know, a happy staff is more productive. We know that. That's a fact.
Very much.
But we got to talk about the customer service side, and that's where we were talking with some of the social media issues. The last time we had you here at Tylon, you were talking about the institution of a complaint policy where people can be able to officially put forward whatever challenges they may have encountered in the system. How have you been working in ensuring that the customer service aspect of the hospital is also progressing in your own plans?
We have hired a complaints officer over the last 10 months, Ms. Tina Gill. We have clearly marked signage in the hospital saying that if you have a problem with the service that you're receiving, please tell us. We live in an era where people put everything on Facebook right away before they even look for an official way to address it. And so I tell people all the time, coming to Channel 5 or Channel 7, going to the media or putting it on Facebook doesn't get the issue resolved. You understand me? So come to us. We are providers of a service. The only way we know how our service is performing is if the user gives us feedback. So come and tell us, hey, this is happening, and we can address it there and then. But we live in an era, like I said, where people will take pictures and put it on Facebook and say, oh, look what is happening here. You understand me? And we don't have a problem with that. We understand that that is the nature of the beast. But I'm saying that if you actually want to get something done about the problem, we have a structure in place to look at you. And so our complaint officer is not just a complaint officer, she is also a patient advocate.
Wow.
We know that our system does have flaws in it, and we know that a nurse might be having a bad day or something and might respond to you rough, and we will apologize. But I also tell the public that we are there to provide a service, not to take abuse.
Yeah.
We understand that your mom is sick and you are stressed out, and so you will talk to us rough. We mitigate for that and understand that we are tolerate you to a certain extent,
yes.
but we're not there to take abuse. So we try to remind the public, when you're dealing with us, we're not the enemy. We are the helpers. We're trying to help you. So don't take out that frustration on us also, and we try to have that extra patience for you. You understand, right?
All right.
Now, and the internal protocols to address issues. I think that sometimes is what people are concerned about. So they make a complaint, but they don't know if anything is done. Are there protocols in place
Yes,
internally?
we do have a complaint mechanism. It is guided by a complaint policy. We've put in the human resource, as Tylon said, to deal with it. We actually track complaints on a monthly basis, and directors are aware of what the complaints are, if it affects their particular, if it reflects issues in their particular area, they're responsible to address it, return feedback to the complaints officer, so that she will be able to know, get back to the whoever the complainant is. There are instances where complaints are filed. The nature of the complaint requires that we sit with them, right? Management sits with whoever the complainant is, and we deal with it from that level. All right, so there is a mechanism. It's communicated throughout the hospital. Everybody is aware. Of course, there will be one or two, users of our facility that may not want to follow that particular mechanism, and that's okay. We look for the issues. We try to reach out to them. Sometimes we might just hear there's a disgruntled patient or family member in a particular area. Could you go out and find out what's going on with them? See what what it is that they may not be understanding.
Yeah.
What is it that's unclear, that needs, clarity, and offer that to them. So, we're looking at that approach as well to, resolving some of the issues.
In your mind, moving forward from 23 years, you'll head into your big 25th as well. What is your greatest priority? What would you like to see be distinctively different at KHMH with you in leadership?
The interaction between our medical and nursing providers and the patient. Priority. I believe that has to be positive. It has to be focused, clear information, communication of information, issues relating to particular disease profiles or disease conditions. I would really like to see an improvement in that area. That would be the first major goal, because most complaints we have are angled around, doctor-patient, nurse-patient communication. They didn't get enough, they didn't understand, they didn't get the feedback they required, and it creates doubt. They tend to mistrust the system, and even though you're on your corner doing the best you can, organizing and planning for them, say that to them.
Can I ask though, how do you overcome the language barrier? Because there are people employed with the institution who do not speak English.
We recognize that as a problem. Just recently, I think this year, we had to put in a classroom session where those medical personnel that were not fluent in English, and basically we had to teach them how to speak.
Wow.
We actually ran a program in the hospital to improve on that. So, wherever the problems are, it's only after you've identified, analyzed, and each problem we try to look at and to see, how can we improve on this or that or whatever it is. And some of the mechanisms that we put in the responses are not even costly. It's just how we coordinate and organize, to improve.
We've touched on a few things that brings me to my question, and for many a times while being there, I've seen it myself. Everybody who goes to the hospital with a certain condition feel like that's their last, and my health is important to me. That individual's health, I prefer to go front or first. Now, I would like for us to iron out this situation because, like I mentioned, if I have a flu and I'm not able to breathe properly, that individual comes in, fingers off, bleeding all over the place, that one takes priority. So let's talk about the priority of, yes, because because folks need to understand that when you get in there, there's somebody who might be worse than you.
We're
and they
talking
would,
accident,
yes,
emergency.
accident, emergency.
First contact.
Yes, and you know what? And one of the things that I love, especially sitting down in the waiting area, there's actually signage there that says, if you come here with this and this individual comes here with this, they get first preference. So let's go through this.
And you're sitting there, John, and you're seeing somebody come with their fingers off. You might see that. What you don't see is the other cases that are being ambulated to the KHMH behind the scenes, the complicated C-section from out district, the person who just had an accident. So you're in the waiting room and you're seeing people walking in, but there are people who are in worse condition being ambulated in. And so we ask the public to have patience. We explain the triage chart, and we have other facilities that you can go to if you have a stomachache and other things. KHMH is there for really emergent cases. So the waiting time is determined by the severity of your injury. You understand me? But there are other things coming in behind the scenes, so people are in the waiting room getting angry, not knowing that our operating theaters are in full swing, trying to actually save somebody's life that is not really breathing. You understand me?
So basically, there are a number of things that we've done at KHMH to respond to things like this. We have a collaboration with the Wisconsin medical team where there's a 5-year plan to improve emergency training for our staff, nurses and doctors. The design of the emergency facility is such that you have one section for ambulatory care where these signs are that you've just pointed out, the triage system, and it clearly explains who is number 1 priority, number 2, number 3, number 4, number 5, and the wait time, the anticipated wait time, it's there. Of course, then we have the ambulance access where patients in real critical condition, they will access emergency through our ambulance access. Now, how do we relate all this? Because the patient, all they see is people moving back and forth. They're busy, or they may appear busy, and they're not dealing with my problem. And my headache is much greater than that saboon over there. So, and I came first. So what is it? So it's just about communicating again with the patients, their family members, explaining to them the situation. And the nurses have been doing a great job doing that. Of course, we have the public, and I must say this, that sometimes they're not very appreciative of what the nurses do. It's just their social background. They must be first, and if they can't be first, there's a big issue, you know? So it's just, how do you deal with that, right? Moving forward.
One of the challenges I find is the communication of the services, and you were touching on it just a bit. What is the collaboration? Let's clearly define this. KHMH is a statutory institution, which means it's quasi-government, it's like half. And then you have the Ministry of Health public clinics where they offer services as well during the day. What is the collaboration like in educating the public that some of the flus and some of the other minor issues can be dealt with at a clinic versus waiting a longer wait time at the KHMH?
The Ministry of Health puts out some public communication. I think there needs to be a little more in terms of levels of care and you know what the different levels of care are responsible for, because we have the primary health care, Matron Ramorts, Port Loyola, those areas that falls under the Central Health Region, and they deal with primary health care issues.
Which means the things that you'd probably wait longer
these are the cough and colds, you know, fever, the sore throat, the headache, backache, fatigue, you know, those type of things. Diabetes, it went out of control a little. You don't really need to be in an accident and emergency, but you need to be in the primary health care. The collaboration is that we do communicate with the regional health manager for Central Region, and we share with them some of the concerns in terms of numbers that are primary care issues. And they've been responding in terms of looking at how can they expand their hours to respond to the demands of the public. So it's a shared responsibility. Of course, in situations when they're not able to respond, then KHMH, we will deal with it. It just means that we can't deal with it if there are other emergencies going on, because the nature of the game is that. And at KHMH itself, we've set up what we call our, like a primary care clinic, where we have medical officers stationed there that will deal with what we call our greens. These are our, level 4 and 5s. I mean, these are the walk-ins that really, they don't really need to be in a hospital bed. They don't even really need a chair or anything. They just need to be seen, treated, and released. So we've also set up a clinic to respond to things like that. But the numbers are growing, the population is growing, and that's another challenge. And the health system just need to respond to things like that.
And that's what I wanted to say. I keep telling people we're no longer a backwater tongue on the side of the river.
I heard that.
Yeah, we want to offer the highest level of care, but that comes at a cost. You walk into the KHMH, electricity is burning, water is burning, the ACs are on. Somebody has to pay for that. The government provides a subvention for the KHMH, but the public has a responsibility to also contribute. And we tell them we don't charge you. We ask you for a portion of what it costs to take care of you, so that the next time your granny, grandpa, your child comes back there, we are there for you. You understand me? But so we're trying to get the public out of the idea that healthcare is free. It's not. And for us to offer that level of care, we need to get all these machines and medications and so on to take care of you.
And I'm glad you touched on that, because that was really the next issue I was getting into, which I think is important. A couple years ago, the Prime Minister had wiped out whatever debt was outstanding. And it is a part of the perception that people have of the KHMH, that it's a place to access free service. And I know for many years you've been battling that. And one of the clear examples I think we can always use is if I get shot, stabbed, whatever, and I go in unconscious and you do everything that you need to do for me, 4-hour surgery, whatever it is, and I recover and I leave, I mean, there's nothing compelling me to pay that bill.
Exactly.
So how do you work with that area? How do you collect on what is owed and educate people? It's not like a private institution where you have to prove payment before you can get treated.
So get in at the door.
When you get to KHMH, you have to get treated. But then you have the responsibility of trying to reclaim the expenses that have been expanded on these people.
Of course, every single patient is billed. They must be billed, because we have to account for the resources that's expended on the care that we provide. So every patient is billed. Of course, some of them pay up front, some pay half in between. We have different payment mechanisms to assist patients in paying their bill. There is a collection effort going on at KHMH. It's designed, I mean, when we're complete with that, we could bring that back on the show, but there is a collection effort going forward, and to really have patients understand, it's a culture shift. It's not about free. Unless we are able to collect for the services that we are offering, we will not be KHMH for much longer, and the hospital needs to be sustained, the services.
And from a public relations standpoint, we have an ad that says I pay BL because electricity is important. We pay BWS because we want clean water. We pay KHMH because we want the highest level of health care possible. And so we emphasize to the patient, take care of your bill so that we can take care of you. It's your institution. We're not charging you. We're not trying to get rich off of you. And it's the same person that sees you at KHMH, sees you at BMA and BHPL. They work with us primarily. So it's the same level of care. Yes, over there the AC might be colder and the curtains are prettier, but they're charging you. We're not charging you. We're asking you to contribute your portion so that the next time we can do the same job for you. And just a statistic, the average person in emergency uses 3 bags of drip, and those bags are costed at $16 per bag. We charge $10 at emergency to see you. So you're already past what we're not charging you. We're already at a point where we've provided service that is more than what you're paying.
My goodness.
Now, collecting outstanding debt is important in the sustainability. And one area, and I want to ask you this directly, in the view of many people, KHMH has just simply outgrown the institution that it now exists in. And we saw the structural damages recently that had to have some areas shut down. What is the plan? What is are you soliciting funds? Are we looking to be able to expand, grow? or are we going to try to fit all we can in the limited space that's
No,
available?
no, no. There are plans to expand. And first of all, KHMH correction, we did not shut down any service. We reorganized our services and we continue to provide every single area of service. So kudos to the staff that were committed through all of that, because that was very hard, but they managed it throughout. There are plans for expansion. Of course, we have to be careful how we expand services because it comes with a cost. We've expanded since 1995. We have 3 critical care service areas: adult, neonatal, pediatric critical care. You like the video, right?
Yeah.
And so it comes with a cost. We just have to, it has to be a planned approach, not to say that it cannot happen.
Yeah.
We've done it already, but moving forward, we just have to be careful that we are able to source every single resource that will be required before and know how it's going to be sustained.
Yeah, yeah.
And,
Now, go ahead.
and it's a 25-year-old building. We continually improve staff.
Yeah.
We have to continually improve our physical structure. It's the most used building in the country 24/7. You understand me? So we're going to have issues. We're going to have to be replacing things, and the older the building gets, the more costly and more consistent that repair needs to be. So it's just part of the growing pain that the KHMH has.
So the roof is fixed now?
The roof,
Yeah.
the beams were fixed.
The beams were fixed. The challenges with the structure were fixed?
Yes.
Yes,
Okay.
it's complete.
And-
It has been returned to
Yeah.
us like 3 weeks ago.
Okay.
Its services are back in operation. Operating room, we still have a minor area that needs to be repaired. Wasn't part of the structural repair. It was part of our operating theater enhancement
Okay.
Ah.
activities that were done some time ago. So we will showcase that because you don't want to see our operating room. It's
So
beautiful.
Can I just get the opportunity though, because I think what is key in this conversation is looking at growth over 23 years, and there are some really excellent stories that come out of KHMH, and there are some highlights that I think perhaps you've neglected to say. One, it is a baby-friendly certified
Oh,
hospital.
yes, it is. Has been for so many years.
And that is a big deal.
It's
I
a
have
big
to say
deal.
that.
That's
yeah.
an international
Yeah.
achievement. That is great.
And,
Yeah.
and we want to say that a lot of people go and have kids at the other facilities. If something happens to your child at these other facilities, they have to go to the KHMH. We're the only institution with ventilators for
Neonatal intensive
neonates.
care.
We have one of the
And
best
pediatric.
neonatal intensive care units in the region. That was first spearheaded by the First Lady. You understand me? So all these things we have, but maybe like I said, we're trying to toot our own horn a little bit more now.
Nothing is wrong with that.
Nothing is wrong with that. It's time to celebrate our
We've
achievements.
heard people speak of stories, you know, when they talk about breastfeeding, the assistance that they get there, the
Second to none.
detail when it comes to knowing the importance of skin to skin following birth. And all of these are part of the initiative of Baby Friendly. I think that's so great, and we don't talk about it enough.
And what's important is that we were able to maintain our certification
Yes.
over the years.
Wow.
So that's great.
So while we
I also see
celebrate
an
the
advertising, just quickly, John, sorry. I also see an advertisement for a breast cancer screening unit. Can you
Yes.
tell us a little bit more about that?
We've had a breast cancer screening unit for a time. We know that this is, besides diabetes and hypertension, that cancer is on the rise, and we just wanted to make sure that we are able to screen our women that fall within the age range. So it's a two-dimensional mammography machine, and there's a process to get your referral to come and see us, but we do have these services.
Okay.
And I
And
would
finally
like
for
to
me-
also say, sorry, that we're looking at our oncology services as well.
Yes.
We've started the outpatient section of it as a first phase, and we're looking at a treatment section of it. So that's going to be phased in, you know, early next year, hopefully. And the plan is there. Everything is clearly mapped out. We have our oncologist on staff. He's
Dr.
already
Yakab.
attending, yes, Dr. Yakab, and he's already attending patients in our outpatient setting.
Yeah.
We do some
I was
chemotherapy
going to
treatment.
ask, the Dangriga Cancer Center said they have some kind of partnership with
Right,
KHMH
we've
where they
worked-
do, for
Yes,
people
it's-
who can't afford to travel to Dangriga,
They come.
offer some chemotherapy
Yes,
there.
we-
So what you're talking is a formalization of this system?
Well, basically, it would be an expansion, really, because they do chemotherapy treatment in Dangriga. They have they have their unit well set up and everything. Now, KHMH is looking towards opening a treatment center,
Nice.
chemotherapy.
Very
So that
important.
would be a big plus, considering cancer is like number 3 leading cause of death in the country.
Wow.
Yeah.
So we have to respond.
You know, and finally for me, while we celebrate the 23rd anniversary of the KHMH, what else are we doing to celebrate this particular milestone? And I call it a milestone because 23 years from 1995 to present, what else are we doing besides visiting the media house?
We had a cookout on Friday, a barbecue cookout. Like I said, we have different cultures. So we ended up doing a bunch of barbecue competition, and we sold tickets. And we had Cuban style barbecue.
Really?
We had barbecue from a smoker. So we did that on Friday. On Monday morning, we had the anniversary ceremony where we invited the staff, and we had a nice worship service. We're visiting the media houses. Tomorrow we've made some nice T-shirts for KHMH, and we've solicited things from different parts of the business community to give away to the staff. Normally we give away to patients, but I said this year, let's appreciate the staff.
Yeah.
So there are companies, and I will forget some of them, like Caribbean Chicken that has given us gift certificates, Caribbean Tire, Fabregas Belize Limited. They've given us a bunch of stuff, so we're just going to find all kind of idle ways to give it away to the staff. You understand? We have cakes by Carla, cupcakes by Essay. So Cambranes has given us some food, so we're just going to give it away and have a fun day tomorrow. Yeah.
All right. Well.
And of course, we've brightened up Carl Huchner, the inside of Carl Huchner a little.
Yeah.
Yes, we've
So the
painted.
staff feels so appreciative that, you know, hey, the place is looking good again, you know. After all those blockades and all those things that were in place for so long, everybody is feeling upbeat, and
Excellent.
that's quite nice.
Well, congratulations on your 23rd anniversary. And
Thank you.
thank you for coming in and having this conversation in terms of your vision for your leadership and also the ongoing work in improving the image and improving the delivery of service. Thank you.
Thank you too.
Thanks for having us.
We're going to go ahead and take a break. When we come back, we'll be talking to representatives of the Department of Youth Services about their upcoming National Youth Awards. So stay tuned.